Hi, I'm Stephanie Vecchio, and welcome to another episode in our History Bites series. Today, in celebration of Women's History Month, we'll talk about 3 unsung women in American history and the incredible and indelible impact they made. We will discuss Nellie Bly, Dorothea Dix, and Dr. Jane Cooke Wright. We'll start with Nellie Bly, who became an unexpected star journalist in the 19th century, ultimately ushering in the age of investigative journalism. Nellie Bly was born Elizabeth Jane Cochran on May 5, 1864, in Cochran's Mill, Pennsylvania. Her father, Michael Cochran, owned a lucrative mill and served as Associate Justice of Armstrong County. When Bly was 6, her father died suddenly and left no will. Unable to maintain the land or their house, Bly's family left the mill. Her mother remarried but divorced in 1878 due to abuse. Bly left school in her mid-teens to help support her family, but found it difficult to find opportunities for women, even though plenty were available for her lesser-educated brothers. In response to an article in the Pittsburgh Dispatch that criticized the presence of women in the workforce, Bly penned an open letter to the editor that called for more opportunities for women, especially those responsible for the financial well-being of their families. The newspaper's editor, George Madden, saw potential in Bly and invited her to work for the Dispatch as a reporter. She used the pen name Nellie Bly, which she took from a well-known song at the time, Nellie Bly, spelled Nelly. While Bly was popular, she was limited to writing pieces that only addressed women, which left her dissatisfied. Bly left the Pittsburgh Dispatch to pursue opportunities that would allow her to write about both women and men. She moved to New York and decided to ask famed editor Joseph Pulitzer if she could write a story on the immigrant experience in the United States. Pulitzer declined, but challenged Bly to investigate one of New York's most notorious mental asylums, Blackwell's Island. Bly faked a mental illness to gain admission and quickly discovered and exposed the abhorrent conditions in the asylum. Her 6-part series on her experience was called 10 Days in the Madhouse and made her one of the most famous journalists in the country. Her reporting shocked the public and led to an increased funding to improve conditions in the institution. Her hands-on approach to reporting ultimately developed into what we now call investigative journalism. Bly would continue to write popular exposés that promoted rights and fair treatment of the American middle class and all people. She captivated the nation with her compassionate writing style and left everyone riveted in 1889 when she decided to travel around the world after reading the popular book by Jules Verne, Around the World in 80 Days. The New York World published daily updates on her journey, and the entire country followed her story. At the age of 30, Bly married millionaire Robert Seaman and retired from journalism. Bly's husband died in 1903, leaving her in control of the Ironclad Manufacturing Company and American Steel Barrel Company. She went on to patent several inventions related to oil manufacturing, many of which are still used today. She also prioritized the welfare of her employees, providing healthcare benefits and recreational facilities. Eventually, Bly returned to journalism, covering World War I from Europe and continuing to shed light on major issues that impacted women. While still working as a writer, Bly died from pneumonia on January 27, 1922. In a tribute after her death, the acclaimed newspaper editor Arthur Brisbane remembered Bly as the best reporter in America. Dorothea Dix was born in Hampton, Maine in 1802. Little is known about her childhood, but historians know she went to live with her grandmother in Boston in 1814, where she attended school and became a schoolteacher. In fact, she established an elementary school in her grandmother's home in 1821, and 3 years later, published a small book of facts for schoolteachers that became quite popular. By the time of the Civil War, her book, Conversations on Common Things, or Guide to Knowledge with Questions, had been reprinted 60 times. Written in a conversational style between a mother and a daughter, and directed at the young women who dominated the teaching profession, the book reflected Dix's belief that women should be educated to the same level as men. However, in the 1830s, she would often become ill, and it was suggested by doctors that she spend some restorative time overseas in Europe. While there, Dix came to know groups of reformers who were lobbying for better understanding and treatment of the mentally ill. After returning to the United States, Dix became a reformer herself, pushing for better mental health care, and helped to establish around 30 hospitals for the mentally ill along the East Coast. When the Civil War started, Dix dedicated herself to the Union. She was designated as the Superintendent of Army Nurses for the Union Army, and while many believed her standards were too high for recruits, the Army of Nurses was extremely successful and crucial in advancing the role of nurses in the war and in the medical field. Dix was also known for treating both Union and Confederate soldiers, a practice which gained her respect from many. During a period when male doctors openly expressed disdain for female nurses, Dix continued to push for formal training and more opportunities for women nurses. Over the course of the war, she appointed more than 3,000, or about 15% of Union Army nurses. She stepped down from the position in 1865. After the war, Dix raised funds for the building of a national monument to honor deceased soldiers, which stands at Fort Monroe, Virginia today. She continued fighting for social reform throughout her whole life. Her work in support of better care for the mentally ill culminated in the restructuring of many hospitals both in the United States and overseas. After suffering from illness, Dix returned to New Jersey, where she spent the remainder of her life in a specially designed suite in the New Jersey State Hospital. She died on July 17, 1887, and is buried in Cambridge, Massachusetts. Dr. Jane Cooke Wright was born in New York City on November 20th, 1919. She was the older of two daughters to parents Louis Tompkins Wright and Corinne Cooke Wright. Her father was one of the first African Americans to earn an MD degree from Harvard Medical School, and her grandfather was born enslaved but later earned his medical degree from Meharry Medical College. Wright's father was also the first African American doctor appointed to a staff position at a municipal hospital in New York City, and in 1929 became the city's first African American police surgeon. He also established the Cancer Research Center at Harlem Hospital. Wright herself graduated with honors from New York Medical College in 1945. She interned at Bellevue Hospital, serving 9 months as an assistant resident in internal medicine. While completing a residency at Harlem Hospital from 1947 to 1948, she married David Jones Jr., a Harvard Law School graduate and attorney. They had 2 children, Jane and Allison. After a 6-month leave for the birth of her first child in 1948, Wright returned to complete her training at Harlem Hospital as chief resident. In 1949, Wright began the cancer research that would make her one of the leading names in the field. Working initially with her father, she made a number of improvements to chemotherapy treatment, an experimental treatment at the time, including using nitrogen mustard agents to treat sarcoma, leukemia, and lymphoma. Following her father's death in 1952, Dr. Jane Wright was appointed head of the Cancer Research Foundation at the age of 33. Wright pioneered the use of patient tumor biopsies for testing against various tumors, and she developed a non-surgical procedure using a catheter to deliver chemotherapy drugs to previously inaccessible tumors in the kidneys and spleen. In 1955, Wright became an associate professor of surgical research at New York University and director of cancer chemotherapy research at NYU Medical Center. In 1964, she was the only woman and the only African American among the 7 founders of the American Society of Clinical Oncology. Also in 1964, President Lyndon B. Johnson appointed her to the President's Commission on Heart Disease, Cancer, and Stroke. Based on the Commission's report, a national network of treatment centers was established for these diseases. In 1967, Wright was named Professor of Surgery, head of the Cancer Chemotherapy Department, and Associate Dean at New York Medical College. At a time when African American women physicians numbered only a few hundred in the entire country, Wright was the highest-ranked African American woman at a nationally recognized medical institution. Wright continued her work tirelessly, and while pursuing private research at the New York Medical College, she implemented a new comprehensive program to study stroke, heart disease, and cancer, and created another program to instruct doctors in chemotherapy. In 1971, she became the first woman president of the New York Cancer Society. In 1987, after a hugely successful and fruitful, storied 44-year career, Dr. Jane Cooke Wright retired as a professor at New York Medical College. She died on February 19, 2013, in New Jersey at the age of 94. Her contributions to the research of cancer chemotherapy have helped to change the face of medicine and save countless lives, and continue to be used to this day. I'd like to thank you all for joining us for today's episode. If you enjoyed it, click like, and if you watched on YouTube, hit subscribe. Thank you so much, and happy Women's History Month.